Hi, everyone. Welcome to SNAP Matters for People with Disabilities, hosted by the Food Research and Action Center. I'm Steve Hayward, FRAC's Communications Manager. Before we begin, I'd like to cover a few brief housekeeping items. We expect this webinar to run about 60 minutes. We are recording the presentation and will send the recording and slides in a follow-up email. Closed captioning is available. To turn captions on, click Show Captions in the bottom taskbar and select English as the spoken language. At the end of the presentation, we'll have time for questions and answers. To ask a question at any time, please use the Q&A tab, also in the bottom taskbar. With that, I'll pass it off to Irene Lewis, Senior Research and Policy Analyst at FRAC. Take it away, Irene.
Thank you, Steve. Hello, everyone, and thank you so much for attending our webinar today, SNAP Matters for People with Disabilities. Can you go to the next slide? So if you have not heard about FRAC, FRAC is a national organization that focuses on improving nutrition, health, and well-being of people struggling against poverty-related hunger. And we do this through advocacy and partnerships around the federal nutrition programs. So in our webinar today, like I said, we'll be talking about SNAP and why it matters for people with disabilities. We have a really dynamic panel for you today, including Kings, Ashley, Louise, and Lauren, who will be introduced later. But I am just here to sort of set the groundwork for our discussion today. So after this introduction, I'll go through a little bit of an overview on SNAP, and then we'll talk about people with disabilities and the unique food insecurity challenges that they face. We'll have a really great panel on best practices for connecting people with disabilities to SNAP. And then we're going to have some time for audience Q&A, and we'll close that at the end. So the Supplemental Nutrition Assistance Program, or SNAP, is the largest federal nutrition program in the United States. It delivers effective and direct assistance to households loaded on EBT cards to purchase food and groceries at participating stores. SNAP supports over 40 million people in the US annually. The program is shown to reduce hunger and improve dietary intakes, while also bolstering local economies and lifting millions out of poverty. Next slide. So how SNAP works. SNAP is administered at the state level, and so households can apply for the program through their state or local SNAP agency. Eligibility for households is determined by the household's income, their expenses, and household circumstances like household size or composition. If a household is deemed eligible, they will get an EBT card that has benefits on them. An EBT card is an electronic benefits card that's similar to a debit card, and it allows households to use those benefits to purchase food at approved stores. And those stores include grocery stores, farmers markets, and in some states and cases, restaurants. Next slide. So for people with disabilities specifically, this population has some special rules around eligibility, allowing them to qualify for the program at a slightly higher resource and income limit. And it allows the population to deduct medical expenses that are over $35 a month. So these things are important and will play into the conversation that we'll have later, but I wanted to just lay the groundwork and talk about how SNAP works broadly as a program. Next slide. So identifying people with disabilities, specifically within SNAP, can be challenging sometimes because of the lack of a universal definition of what a disability is. And this is specifically important within the context of SNAP because SNAP defines a person with disability around the reception of a specific benefit. So you would defined as disabled under SNAP rules if you are receiving some sort of federal disability benefit under SSI or Social Security, some sort of state disability payment, a disability retirement benefit, or if you are the surviving spouse or child of a veteran who received VA benefits. So we'll talk about this more in the conversation, but these are sort of the rules around how SNAP defines a person with a disability. So with this definition, we still know that SNAP is a critical program for this population. In fiscal year 2023, SNAP served an estimated of 3.8 million households that included some working age adult with a disability. So this was anybody between the ages of 18 and 64. 33.9% of households with a working age, percent of households with a working age adult is out of the workforce due to a disability. And this population is 4 times more likely to experience levels of very low food insecurity, which is known to disrupt regular eating patterns. So this is why SNAP is so important. And we know that on average, SNAP households that have a working age individual who has a disability receive about $266 per month in SNAP benefits. And like we said, these benefits are really critical in helping to bridge the gap between being able to afford really critical resources like food. Next slide. So that's sort of our broad overview that we have. I'm going to pass it off to Lauren, who is our amazing Bill Emerson Fellow, who is going to lead us into the rest of our conversation. Thank you so much. I'm really excited for this.
Yeah, thank you, Irene, and hi, everyone. Thank you for joining us. As Irene said, I'm Lauren Walcott. I'm a Bill Emerson National Hunger Fellow with FRAC on both their child nutrition and SNAP teams. And as it was mentioned, SNAP is the nation's first defense against hunger. And despite that, many eligible people with disabilities do not have access to SNAP. And so to discuss this further, we are joined by some wonderful panelists and Kings Floyd for some additional context. So Kings is a senior research and policy associate for the Disability Economic Justice team at the Century Foundation, and she's a disability rights activist, access coordinator, and writer based in Washington, D.C. and Portland, Maine. We are also joined by 2 of our panelists. Our first is Ashley Burnside, who is a senior policy analyst at the Public Benefits Justice team at the Center for Law and Social Policy, also known as CLASP, where she specializes in TANF cash assistance, the child tax credit, the earned income tax credit, SSI disability benefits, and disability policy issues. And we're also joined by Louise Hayes. Louise has been a public benefits attorney at Community Legal Services of Philadelphia since 1997. And in the early 2000s, she was a consultant for FRAC and helped edit the Guide to the Food Stamp Program in 2005. And so as you can see, we're joined by some pretty incredible people who will help us discuss the unique challenges of food insecurity among people with disabilities and best practices to increase access to SNAP. So thank you for joining us. Thank you for your time today, guys. To start us off, we'll have a brief presentation from Kings. So Kings, if you want to take us out.
Wonderful, Lauren. Thank you so much. It is an honor and a pleasure to be here today with you all, although I wish it were under better circumstances for our nation. Again, my name is Kings Floyd. I present as a white woman with brown hair. I'm in a braid and glasses today with a mustard shirt and a pearl necklace. So I'd like to start us off by kind of really painting some broad strokes about the disability community as a whole. I think this is a well-known statistic, but if those of you that don't know, it's 1 in 4 Americans has a disability. We can narrow it down to approximately 28.7%. Disability, as we also know, can have serious economic consequences. One study estimates that by the 10th year after onset of a disability or chronic illness, average earnings fall by 76%, family income falls over 25%, and food and housing consumption fall by 25%. We also know, in tandem to that, people with disabilities are twice as likely, in some cases double that, to live in poverty and struggle to put food on the table, otherwise be food insecure. And for every person that has a disability, their chance of experiencing food insecurity increases by 19% with every additional diagnosis, according to the National Library of Medicine. SNAP is a lifeline to these people. It provides needed food assistance to millions of people with disabilities, or over 1 in 4 SNAP participants who have a disability or receive disability benefits, according to a survey done in 2015. I know that data is pretty old. Unfortunately, I don't have access to more recent data, but from my hypothesis, I would assume that number had gone up significantly, especially with the impact of the COVID-19 pandemic. and the lasting impact that that has had on our community and society. So I'll go a little bit into the data before kind of zooming out again and then turning it over to my fellow panelists. In 2023, households that included an adult with disability reported higher food insecurities than households with no disability. That should come as no shock. As we've already discussed, 33% of US households that include an adult were food insecure, sorry, excuse me, and include adult with a disability. In contrast, only 10.5% of households without an adult with a disability were food insecure in 2023. That's 22% more. I find that statistic startling because it really dictates how much more unstable the economic and basic needs threshold for people with disabilities is. As we've kind of discussed before, and as I'm sure my colleagues will discuss further, SNAP has very rigid income limits and work requirements that push people with disabilities to make impossible decisions and don't allow them to save. It's also incredibly difficult to make SNAP benefits work for someone that has a chronic illness or disability that requires specific dietary guidelines or nutrition. In Maine, which is where I live, the average family with a disability on SNAP benefits receives about $200 a month in benefits for SNAP. That averages to about $5 per person per day. Imagine getting by on $5 worth of food per day, especially if you have a disability. That means you can't have processed foods like myself. The application process and the burden of proof on the individual with a disability filters needy and worthy people out of the program through its engineered bureaucracy. SNAP's definition of disability also gatekeeps people from the program, and rural communities face significantly higher percentages of both disability and food insecurity. I know that was a lot of information for you all. I hope that was helpful in kind of table setting some of the information that we're working with and the circumstances that we're working around. With that, I will turn it over to my incredibly capable colleagues to continue this discussion. Thank you so much.
Thank you, Kings. We really appreciate you for sharing that sobering reality. And so I'm going to turn it over to Ashley just to expand some on the importance of SNAP for people with disabilities facing food insecurity.
Thank you, Lauren, and thank you, Kings, for that overview. Before I dive in, I'll just give a quick visual description. I'm a white person with brown hair that goes past my shoulders, wearing glasses, a black V-neck, and I have a blurred background behind me. Thank you to FRAC for having me in this discussion. Kings really set the tone well for me and made this opening question pretty easy. I'm just going to kind of re-emphasize some of what she said and just really name that it's very expensive to be disabled in America, and that's why programs like SNAP are really important. Being able to just maintain a baseline healthy life when you have a disability means you have to afford a lot of essentials like medicine, therapies, adapted clothing, wheelchairs, specialty diets, like Kings was saying, and all of that costs money. I think there's a really compelling Century Foundation report that says for households with a disabled person, they need an average of an extra $17,690 per year just to have the same standard of living as a household that doesn't have someone with a disability in it. So that's nearly $18,000 more per year just to have that same baseline standard of living. And as King said, people with disabilities are likelier to live in poverty, at least twice as likely to face food insecurity, likelier to be paid lower wages for their work, face many barriers to entering the labor market. And for all of these reasons, SNAP is just such an important benefit because it gives people this monthly support to buy groceries. And there is more agency for recipients of SNAP to decide what food they're buying than you may get at a food pantry or a food bank, where you're limited to the foods that are being offered in that space. So if you're somebody who does have dietary needs specific to your medical condition, with SNAP, you can use your money in the grocery store to, for the most part, buy with what you need, with some restrictions that we'll talk about in a bit. So SNAP is a very important program, but I will name, like Kings was saying, the benefits have not kept up with the cost of living over time. So while the benefits are a lifeline for people, they often do not meet the costs of every single meal every day that a household will face. So it's one important support, but there's a lot of expansions that are needed to really allow it to help people get to a point of food security and food stability.
Okay, thank you, Ashley. And I'm going to turn over to Louise just to see if anything that Kings or Ashley has mentioned, how you've seen it play out in Philadelphia.
Great. Thanks, Lauren. I'm Louise Hayes, a white woman with long brownish hair and a braid, wearing glasses and a dark pink shirt in my office with a big window behind me. Disability benefits that most of my clients who receive disabilities receive are not enough. So this is one thing that Kings and Ashley haven't pointed out, that SSI, supplemental security income, which is a major source of income for most of my clients with disabilities, only pays $967 a month. This is less than 75% of the federal poverty level. And so that's one of the key reasons why SNAP is so important, to supplement this inadequate income, in addition to the things that Kings and Ashley were just saying about how living with a disability is more expensive than living without a disability. But the amount of income available to my clients is typically much lower. So SNAP is really there to fill in the gaps as much as it can.
Absolutely. Louise, since you work with clients and households with people with disabilities can sometimes be hard to contact because some people might be isolated. And this can make it difficult to let people know that they're eligible for SNAP or that there are ways that you can offer assistance. What are some methods that your organization uses to reach households with people with disabilities?
Well, we certainly don't have a magic outreach wand, but we do our best. We, of course, use social media. We've got a website. And then we work with a lot of disability rights groups and organizations that provide direct assistance to people with disabilities. And we do trainings for like case managers. For years, we worked with the city of Philadelphia, which ran trainings for people who work in the behavioral health system, to help educate those case managers about SNAP rules, and to encourage them to send people who are having SNAP problems to us. We at Community Legal Services represent about 1,600 people a year with public benefits issues.
Yes, thank you for sharing that. Developing relationships with these organizations is one of the most critical best practices that organizations looking to increase access for folks with disabilities can take. So thank you for sharing those avenues. Switching a little bit to talk about some challenges and lessons. Medical and specialized diet costs, as we have mentioned, quickly add up for people with disabilities, and makes programs such as SNAP a particular asset to this population. And despite this, as we have discussed, there are significant barriers to accessing SNAP. And so SNAP, for instance, has work exemptions for people with disabilities, but the SNAP definition for what a disability is relies heavily on proving that people receive supplemental security income, or SSI. So Ashley, can you share a bit more about how SNAP defines people with disabilities and the benefits and drawbacks to this?
Yeah, definitely. It's a very important question for understanding the barriers for people with disabilities to access SNAP, is the work requirement exemptions at play. So like you said, SNAP has work requirements for its recipients, and one major way that somebody can be exempt if they have a disability is through receiving different disability benefits like SSI or SSDI or state disability benefits, certain other benefits. And that means if somebody is receiving SNAP and already getting SSI disability benefits, they generally would not be held to the work requirements. And that is good because that means for that person, they don't have to resubmit paperwork proving the disability that they've already proven to a state agency. And it does reduce the burden for that person. I will just emphasize that it's a very time-consuming process to apply for SSI. It can be expensive, it can be time-consuming, it could be confusing, especially if you don't have an organization or person to help you with the application. And there's a backlog for getting on the disability programs that can be months or even years. And unfortunately, the Social Security Administration that oversees disability benefits is very understaffed and underfunded right now. And that's likely only going to get worse under this administration. So that backlog is only likely going to get longer. So for people who can qualify for SSI and then therefore eventually meet this work requirement exemption under SNAP, it's going to be really hard if they still have to wait months and months to get on the program. And that's going to mean there's months and months of time where that household may not be getting food benefits or their disability benefits. So I just want to emphasize that even with that exemption in place, there are still people who will have to make hard financial choices and potentially fall through the cracks because those programs can be very hard to access. And I will name that there's a SNAP work requirement for a population called able-bodied adults without dependents. The acronym can be referred to as ABODs in wonky policy speak. And despite the name, people with disabilities can get caught up in those exemptions if they're not receiving the disability benefits I'm talking about. If somebody can prove that they're unfit for employment through documentation from a medical provider, that can qualify them for an exemption from the ABOD work requirements. And I use air quotes to be clear because that's the language in statute. That's not the language that I would use to describe this population. But I just want to name that even getting documentation from a medical provider proving someone's disability is quote unquote severe enough to qualify them for an exemption, that also comes with barriers. That requires needing to have access to medical appointments, to transportation to get to those appointments, health insurance, or the money to pay out of pocket if you don't have health insurance, and going through a lot of paperwork. And there's research that shows that if a patient is a woman or a person of color, especially a Black person, medical providers are likelier to dismiss someone's reported pain and symptoms simply because of those identities. So depending on the identity someone's bringing into a medical clinic, they may not get the same diagnosis as somebody else, especially if they have a more complex or invisible disability that may not be as widely known to providers. So I say all that to say that even with exemptions in place, it's very easy for somebody to fall through the cracks and not get the exemption from work requirements, even if they have a disability that makes it very hard or in some cases impossible to work so many hours per month. And that ultimately means that person would get cut off of their SNAP benefits, even though they should be exempt because they can't get through all of the hurdles and paperwork and logistics to prove that exemption.
Absolutely. Thank you for sharing. Louise, is there anything you want to add about this?
Yeah, this is a tricky area because the SNAP definition of disability that Irene started with basically requires that you're getting another disability benefit like SSI or Social Security disability. And if you're considered disabled for those, then you're considered disabled in the SNAP program. And there are certain rules that are sort of more favorable for people who are considered disabled for the SNAP program. And I'm sure we'll get into that. You don't have a cap on your shelter expenses. You can deduct your medical expenses. So there are reasons in the SNAP program you want to be considered disabled. But the work requirements are a different animal. And as for the reasons Ashley just said, a lot of the people that we serve do have disabilities, but they aren't getting SSI or Social Security disability yet. They may be in the process because, as Ashley said, it takes years. But it's a different standard to be exempt from the work requirements than to be considered disabled. And this is one of the things we here in Pennsylvania are working on very much right now, because this work requirement or time limit where you can only get 3 months of SNAP in 3 years if you aren't working 20 hours a week has never applied in Philadelphia for the last 25 years because we've had a geographic waiver from this rule. It's about to go into effect in Philadelphia for the first time, and we are trying to get the world to understand, all our clients to understand, you can be excused from the work requirement if you are considered unfit for employment, this sort of unpleasant term that the SNAP rules use. But in Pennsylvania, this definition of who is unfit for employment, this is created by the state agency, gets to define this. And it's a pretty generous standard here in Pennsylvania. If you have a physical or mental condition or illness that reduces your ability to work, you are considered unfit for employment. And that's a pretty generous standard. And so what we want the world to understand, or Philadelphia to understand, our clients to understand, is if you've got a medical condition that limits your ability to work, you need to take this form to your doctor. And then we need to get doctors to understand that if you sign this form, then this makes a difference between maybe eating and not eating for your patients. Because if that form is signed, then people will not be cut off by the time limit and can keep their SNAP. If it's not, I think experience in other states shows that people who are not exempt from work requirements overwhelmingly just get cut off and lose their source of food for, up to 3 years.
Thank you, Louise. Yes, and also just to ask, when you're helping clients, what are some of the common challenges or specific challenges that people with disabilities face when trying to apply for SNAP?
Well, one of these problems is that it's so hard to get SSI, so that they aren't considered disabled for SNAP purposes. In order to get SSI, you have to have a medical impairment that keeps you from being able to do any substantial gainful activity for at least a year, or this impairment will kill you first. It's a pretty strict standard. So a lot of people, say people in cancer treatment who really can't work, but if it's not expected to last at least a year, then they're not going to be able to get SSI. And then there are challenges for people trying to get legal help to get their SSI application. People who have long histories and who are seeking Social Security disability, which is what you get when you've paid into the system long enough, they can generally get lawyers pretty easily because lawyers get paid from your back payments, and there may be a lot of back benefits for lawyers to be able to tap into, but it's a lot harder for people seeking SSI, or people with mental health conditions, which are maybe harder to win as an SSI case. And people who aren't in treatment generally have very difficult SSI cases.
Okay. Yes, so thank you, Louise and Ashley, for talking about some of these challenges that folks face. We're going to pivot a little bit to talk about some administrative solutions in regards to SNAP. So state options allow state agencies to tailor SNAP to their policy preferences. And there are several options that can ease access for people with disabilities. And one of these is the Combined Application Project, also known as CAP. And only 58% of adults with supplementary security income received SNAP benefits in 2019. And so the Combined Application Projects help streamline the application process for both programs, and CAPs use information from SSI clients already available in the Social Security Administration system. And while the USDA is no longer accepting CAP applications, they have helped states enroll SSI clients into SNAP with minimal paperwork in states that already have them. So Ashley, I was wondering if you could just talk a bit about the benefits of combined application projects for states that have them.
Yeah, my answer here is really intuitive. I'm not saying anything that shocking, but when you combine applications, so someone only has to fill out paperwork once, that's going to help make the process a lot easier for people, is really the consensus here. Like anytime you can reduce how many times people have to submit the same paperwork, the same information to different agencies to apply to slightly different programs. That's going to create burden. And people living in poverty have a lack of time, a lack of energy, a lack of bandwidth to navigate a lot of different programs, applications, if you're facing financial crises, which is what a lot of people are facing when they're applying to programs like SNAP and SSI and Medicaid. So anytime that you can combine program applications, that's going to make it easier for the applicant. It also may reduce the risk that they just don't apply because they're unaware of a different program existing. And it also reduces the bandwidth for the state agency because it's reducing the paperwork that the state agency has to go through if everything is already in the same form and not needing to be re-verified multiple times because it's slightly different programs that the same household is applying for. So that is one important way to make it one bit easier for a household to apply for these benefits, is just to reduce the amount of paperwork the same person needs to fill out in a redundant way.
Thank you, Ashley. Yes. So in fiscal year 2024, 17 states operated CAPS, including Pennsylvania. But Louise, can you talk a bit about CAPS, the benefits of CAPS that have happened in Pennsylvania and what the status of them are, what they are now in Pennsylvania?
For over 15 years, Pennsylvania had a CAP program, which meant that I don't think I ever saw, during that time, a client on SSI who wasn't getting SNAP. The problem of SSI recipients not getting SNAP, that only 56% number that you were citing, was solved in Pennsylvania, which was great. What we saw, though, is the CAP benefit amount that was issued to people on SSI got to be well lower than what they would have received if they had applied for SNAP the regular way. And I and other advocates spent a lot of time trying to fix that problem, trying to get the state of Pennsylvania and FNS to fix how much the CAP benefit amount was here. And we never succeeded in that. And Pennsylvania earlier this year decided to end the CAP program altogether. And the reason they did that was that the Social Security Administration wasn't doing its job under its agreement with Pennsylvania to run this CAP program. And Pennsylvania was getting hit with quality control errors for people who were in the CAP program who weren't getting recertified properly by Social Security. And Pennsylvania sort of threw up its hands saying, we're not going to be able to get Social Security to do this right. And we can't take these quality control errors, which is even more the case now with the upcoming changes to the SNAP program. So now many people on SSI who transitioned from CAP to regular SNAP are getting higher amounts. So we're glad to see that. On the other hand, what we expect to see is people on SSI who aren't getting SNAP at all, who aren't going to be able to navigate the system. So there's definite winners and losers in this decision.
Absolutely. Well, thank you for sharing. And next, we're going to talk about a different state option, which is the Elderly Simplified Application Project, also known as ESAP, which lets states waive the interview component of the recertification process and provides up to 36-month certifications for households with all adult members who are older adults or have disabilities and have no income. So, Louise, if you could answer, can you discuss why removing the interviewing and making certification periods longer is beneficial for people with disabilities?
The ESAP is hugely beneficial, and actually this is one of the reasons why that Pennsylvania cited for eliminating our CAP program. They said, well, we've got ESAP now, and that does have many of the virtues of the CAP program, except for this grabbing people on SSI and making sure they get SNAP even if they haven't applied. But the interview is a huge obstacle for people with disabilities and people without disabilities. Pennsylvania data show that about every month, about 25% of people who apply for SNAP and have their case denied, have it denied because they didn't do the interview. Just this a letter goes out saying we're going to call you at this specific time that hasn't been scheduled in advance with the person who may have a doctor's appointment that day. The caseworker who was supposed to call at that specific time may be sick that day or may have jury duty. And so the call doesn't come, and then people struggle to get through on the phone to get it rescheduled. This has just been a chronic nightmare for decades. And so anything that can be done to excuse people from the interview, and it makes a lot of sense that families that are have elderly or exclusively elderly people or people with disabilities, their income is typically very stable. And there's less need for an interview because their situation hasn't changed since the last time. And the 3-year certification period, the same thing. People lose their SNAP because of paperwork reasons. It's not like they've suddenly gotten too rich for SNAP. I almost never see that. Certainly not if folks aren't working, they don't suddenly get too rich for SNAP. But a lot of people, and many people with disabilities, have trouble getting that paperwork back in. And the more you can reduce these procedural hurdles, the more people will remain be able to get SNAP and keep it.
Thank you. Yes. Okay. So thank you for your insight on ESAP, and your enthusiasm about ESAP as well. And the next state option that we'll be mentioning is the restaurant meal program. So, recognizing that people who are elderly or older adults that are people who have disabilities or who are experiencing homelessness may face particular challenges with purchasing or preparing food at home, SNAP allows states to implement the restaurant meal program, which allows these 3 target populations or their spouses to use their SNAP benefits to purchase meals at approved restaurants whose menus include low-cost offerings. And so, Ashley, if you could just talk briefly about the benefits of the restaurant meal program.
Yeah, the restaurant meal program is an important option because if you have a disability, it could be harder for you to cook. It could be harder for you to physically maneuver around a kitchen. And that means that if you have the restaurant meals program in place and someone who's receiving SNAP can instead choose to go to a restaurant to have their food cooked for them, that will make it easier for that house to get enough food that day. And that is also putting money back into the restaurant with the SNAP benefits into the local economy. And because under SNAP, you aren't allowed to buy prepared foods. It's a policy called the hot meals ban. So if somebody's going to the grocery store and there's a cooked rotisserie chicken for sale, a person wouldn't be allowed to use their SNAP benefits to buy that chicken because that chicken's already cooked. They could use their SNAP benefits to buy a frozen chicken breast, but if you're somebody who has a harder time cooking, that's going to make it a lot harder for you to get that protein. So the restaurant meals program is a way to work around this in the sense that it allows people with disabilities, people who are elderly, people who are homeless, the opportunity to buy prepared foods with their benefits via restaurants. I will note that there are other people who could benefit from having prepared foods, like parents with young kids who may have been working all day and may not have time to go home and prepare the frozen chicken. And I just have to name that this policy is really rooted in a paternalistic assumption within the SNAP program that people can't just choose for themselves what foods they're buying in the grocery store. In an ideal world, we should trust SNAP recipients to decide for themselves, when I'm entering this grocery store, what is the food that's best for my body, for my health, and for the health of my family? And sometimes that may be prepared meals, and sometimes that may be food from restaurants, and sometimes that may be food from the frozen section, and that's all great. So the restaurant meals program is an important workaround, but at the root of it, we should just eliminate those bans altogether and let people buy whatever they decide is best for their family, just like everyone else can.
Absolutely agree. Thank you, Ashley. For the last state option that we're going to mention, it is the standard medical deduction, which simplifies the process of allowing individuals who have disabilities who are 60 or older to deduct an out-of-pocket medical expense in excess of $35 from their countable income. And so this excess medical deduction results in a lower amount of countable income, which typically leads to recipients qualifying for a higher SNAP benefit amount. Louise, this deduction is underutilized with only about about 5.3% of SNAP recipients claiming it in fiscal year 2023. Can you discuss why people with disabilities might not be using this deduction?
Sure. There's a couple reasons. One is people don't know about it. I think Pennsylvania's caseworkers, who are very busy in those interviews, just don't have a lot of time to explain you could be getting more SNAP if you have medical expenses and you can prove them to us. The proving the medical expenses is also a huge barrier. So you have to you get a deduction for your medical expenses over $35 a month, but that means you're bringing in your receipts for your copays for your prescription drugs, and maybe you're showing how often you went to the doctor and how much it costs to take the bus to the doctor. That's just really burdensome for a lot of people. I mean, some of it is easy if people are paying for their Medicare Part B premium. At least in Pennsylvania, the state can see that in their own computer, and they can give that deduction. But the sort of individual ones that people have to prove, it's very difficult. So this is why there is this state option called the standard medical deduction that about half the states have, that says if you can prove you've got at least $35 of expenses, medical expenses, we're going to treat you as if you have, we're just going to assume that you have, say, 110 or 90. Different states set different amounts, and then they will give people with disabilities or seniors that amount of a deduction when they calculate your SNAP amount. Basically, it means more SNAP because they're assuming, even if you don't prove it, that you've got these medical expenses. The trouble with this option and why Pennsylvania hasn't taken it yet is that the Food and Nutrition Service requires the standard medical deduction waiver, I think it's a waiver, to be cost neutral. So they say, well, if we're just going to assume that people have this much in expenses, that's going to cost us more, and state like Pennsylvania, you have to save us money in other ways. So what most states do is they reduce what's called the standard utility allowance for all households, just a tiny bit, in order to fund this standard medical deduction for seniors and people with disabilities. But it does mean that basically you're robbing Peter to pay Paul with this option, which makes it a little less desirable.
That makes a lot of sense. Thank you for sharing, Louise. All right, so those are the end of our pre-planned panel questions. And so I'll give the audience an opportunity to submit questions. So if you look at the bottom of your screen, there should be a Q&A button that you can submit some questions. And in the meantime, while folks are submitting those, I wanted to give you, Ashley and Louise, time to offer any final comments or things you want to talk about. And if not, that is fine too. Okay.
Can I just mention Heat and Eat, which is another way that people with disabilities, especially now with a new law, get treated a little better in the SNAP calculation and are more likely to get a SNAP benefit that is sort of meets their needs than people without disabilities. I mean, I wish this was more widely available, but do want to say that Heat and Eat is the term for a coordination between the SNAP program and the LIHEAP program, which provides utility assistance. And this particular form of coordination, which I think most states have done for decades now, results in higher SNAP benefits for many people. And the new law that just passed earlier this month is eliminating this particular benefit for households, but keeping it for households with a senior or people with disabilities. So it is important that people with disabilities get credit for all of their utility expenses, even if their utilities are included in their rent. And I'm very glad that at least seniors and people with disabilities will continue to be able to get the full utility allowance.
Absolutely. Thank you for adding that. Yes, that's really important. Okay, so for a question, one of the questions is, are there any initiatives currently to educate medical providers about these forms and their impact to benefits? I'm assuming this is about helping folks qualify for the exemption.
So I think this is going to be a really local thing. Possibly the national sort of medical organizations, national nurses organizations are communicating with members, but really it's going to get down to folks on the ground locally. Certainly we're local legal services program, but we have various connections to federally qualified health centers, hospitals here in Philadelphia, and we're going to be using all of them as best we can to educate folks in Pennsylvania. And I bet there are people like me in all states working on these issues. As I say, we're very focused on this at the moment because it's new to Philadelphia. It may be harder in other places where it's not so new to be having a real campaign on this.
Okay, another question is, do you know anything about food as medicine benefits through Medicaid?
I'm less familiar on that aspect of the Medicaid program. Louise, I don't know if you know too many details.
Pennsylvania had sought a waiver to be able to use Medicaid funding to provide medically specialized meals for people in certain with certain medical conditions. And at the end of the Biden administration, that waiver was approved, but I think it's since been canceled. It was an exciting moment.
And then another question is, this person says they are an advocate working for my state legislature, and wondering what state level policies we can push that would make the biggest difference for people with disabilities. So what would you say would make the biggest difference for folks? Does that make sense? I can ask again.
I'm waiting for Ashley, but
I was waiting for you as the state person, but I will go first and we can vote. There's a lot of things that could be done. It's hard to think what would be the biggest impact, but I mean, we've already talked about different state opportunities throughout this presentation of things that states can opt into to make SNAP more lucrative for people who need it. So I would definitely refer to all of those things. I think as much as we can expand opportunities for applying to benefits is really important, providing training for caseworkers like Louise was explaining earlier on anti-discrimination, disability, anti-bias work, training medical professionals like we've been talking about, providing opportunities to apply over the phone, online, in person. All these can help reduce barriers for applying to programs like SNAP. But we're in a moment right now where states are going to be facing a lot of financial constraints because of the bill that just passed Congress, this reconciliation bill that I'm sure everybody on this call has heard about one way or the other. I think what's most important is making sure that states are continuing to invest in their SNAP program. There's new cost shift requirements that states are going to have to meet in the next couple of years to invest in their SNAP program state by state, and that's new. States haven't needed to do that before. And that's going to put a lot of financial pressure on states. So I think anybody on this call who's a state advocate, I think a very important call to action is making sure your state is prepared to invest in SNAP moving forward as these new requirements go into effect. because there is a very real risk that some states may not invest in SNAP in the way that it needs to be invested in, and that the program could be clawed back in states in ways that would be really detrimental to people. So I think those are conversations that are really important to be happening at the state level, and it's going to look different state by state. But really engaging with your state lawmakers and state agencies about what this bill will mean for your state and how to prepare for it, I think is really important.
And I'll echo all that. And I think the question was somebody thinking about what legislation could be proposed in my state. So it really depends on what your state's already doing. But if it doesn't have a ESAP, Elderly Simplified Application program, absolutely getting the state to do that. The Restaurant Meals Program, the Common Application Program, if FNS ever let other states into it. And maybe defining what's unfit for employment in a more generous way to make sure that people who aren't yet getting disability benefits still can be excused from the work requirement.
Yeah, that's a very, very good point. There is, like you were saying earlier, some flexibility given there within the statute language. So as much as states can be accommodating of all the different types of medical providers that can be allowable for getting documentation and the definition of disability that's being used, to also include health conditions, like you were saying earlier, like somebody who may be navigating a cancer diagnosis, for example. That's really important because, like we were saying earlier, it can be really hard to get that paperwork filled out and get that exemption met otherwise.
Okay, the next question is kind of specific, but here it is. So I've noticed when helping submit SNAP renewals that sometimes people are receiving SSDI, but not labeled as yes in the disabilities section. Is this something we should change to ensure they are exempt from ABOD?
That sounds like maybe a problem with this way your state's computer system is set up, because or maybe just caseworkers are being lazy and are not being, or the system doesn't prompt them well enough to make them check that box. But absolutely, anybody who is getting disability benefits from Social Security should be exempt from any work requirements, and the state's computer system should make that seamless and flawless.
Okay, well, I think that's it for our time for questions. So I think, Irene, is there something you wanted to do for closing?
Yeah, no, thank you all so much for attending our webinar today. Thank you to our speakers, Ashley Kings and Louise, for joining us, to our comms team for helping us to put this together. And lastly, I really wanted to give Lauren a huge shout out and thank you for planning the webinar and hosting our webinar. For those of you who don't know, Lauren has been our Bill Emerson Fellow since earlier this spring. So she's been with us for several months and has been working on updating a lot of our resources that you'll see coming out in the next several weeks. So this webinar is just one of several resources that we'll be sharing. For those of y'all that were curious, the webinar will be sent to your email. But in addition to that, you'll also get a report that we're updating that will have a lot of the information that we've had in our discussion today, just around why SNAP is so critical for people with disabilities, some data and information about food insecurity among households with disabilities, and then again, these best practices and policy solutions to help better connect people with disabilities to the SNAP program. So Lauren has done an incredible job of updating that report and really diving into the most recent research and data. And we've also are developing some fact sheets and some blog posts to go with that. So just continue to be on the lookout in your email for that information. But again, really grateful to Lauren for her time at FRAC and for all of her hard work. She's worked tremendously hard and I'm extremely proud of her. And again, thank you to our speakers for joining us today. So I think that's it. I'll leave it to our speakers to see if anyone else had any last words before we close out today. Go ahead, Ashley.
Oh, just thank you for having us, and happy Disability Pride Month to everyone on the call.
Yes, echoed. Thank you and happy Disability Pride Month.
Thank you so much, everyone. Thank you for joining us, and we hope you have an amazing rest of your day.